is that there's so much stigma and so much weight and so much shame around addiction that when they understand that they're not a bad person because of this, that it's not all bad, that it was this positive solution. It was just the best way that their subconscious came up with in that moment to be able to fulfill that need, to comfort them, to make them feel better so that they didn't have to deal with whatever that was when they were overwhelmed or dealing with trauma. Then it just lifts that. And we just see that, it's not them that's bad as a person. It's just the strategy. It's a poor strategy. But the intention behind it was sound. I have literally worked with people who were 3 years old and 73 years old that were dealing with that same I'm bad, that feeling of unworthiness, that feeling of shame and that weight. And it doesn't have to be that way. We all have the ability to change at every age. And that's what we get to help people with, is we get to help them to shift those thoughts and feelings and then behaviors. And so one of the things that I teach clients is how to do these pause and check in types of strategies. And then that way they can reconnect in that moment. They can check in with themselves. They can reconnect themselves. They can see, how am I feeling? What am I experiencing in my body? Because our thoughts create emotions, which are physiological responses in our body that we put words to. And then we have our behavior.